Let me be honest. I love my profession as a medical biller. But as a new medical biller, there are some things that you need to know that other billers don't tell you. They say, get into the field. They say, medical billers make a lot of money. But if you are really and truly wanting to do medical billing and do it correctly, it is a lot more to that than what they tell you. So in today's video, I'm going to tell you what they don't want to tell you about medical billing as a new biller. So keep watching. Now I've decided to do this video because although I've been in the medical billing field for close to 20 years now, only recently, probably like the past, 4 or 5 years, have I really been into it. And I've been into it enough where I have been speaking to a lot of other different billers or people who are interested in billing. And I've just been hearing so many different things that sometimes get me annoyed or upset because it's like, just get into the field, it's going to bring you a lot of money and, it's so easy and you can just do this and you don't have to know what to do. You don't need to go to school. They just tell you all types of things. And I just find that it is unrealistic and it's not really how things go on, especially if you want to do things right. So I'm going to go over 3 things that they just don't tell you, or maybe they just don't want you to know until you actually get into billing. So if you're already in billing and you agree with me or you have a couple more, please do leave those comments below because I would love to hear what you think about some things they just don't tell you as a medical biller. So first and foremost, and I had to put this as number 1, is that medical billing is not black and white. It is mostly gray. I'm saying that because since starting this channel, I get, questions in the comments, I get DMs and emails and all of that stuff. And I get people telling me or asking me to, show them how to bill or tell them how to bill. And I guess I can understand where they got that from because, again, people make it seem like it's just 1 + 1 is 2, 2 + 2 is 4, and you'll be fine. So where in that example, when we learn math, 1 + 1 is 2. 1 + 1 cannot be anything else but 2. That is not how medical billing is. So there may be some things that are universal for the most part. Let's say it's universal that we mainly use claim forms when it comes to sending our claims to insurances for certain services, for the practice, for the professional fee, let me say it that way. We use a CMS 1500 claim form, and that's normally universal. But even with that, let's say 99% of people want their claims on a CMS 1500 form, and then you might find that one insurance payer that says, no, I don't want a 1500 form, I want an invoice. So where you may think something is universal and that is what it's supposed to be regardless, nope, that's not it. So let's say I'm trying to teach you how to fill out a claim form. And if you want to know about that, I do have a video talking about how to fill out the claim form. And I'm going to do an updated one because that one is pretty old. But I give you this video about how to fill out claim forms. And so you do this for each and every payer that you have. But you might have a few payers that deny your claim or reject, let me use that word, reject your claim, and you want to know why they're rejecting the claim. Because isn't it supposed to be black and white? The claim form is so easy and simple to fill out, but it really isn't. Because some payers want things a specific way. They don't want you to fill in certain blocks, like Medicare, even though the block may say to put the last name first and then the first name last. They may want it vice versa, and this is just an example. But my point is that you may do something for the majority of payers and get your claims paid, but then there may be 1 or 2 or 3 payers that have a different set of instructions and rules for you to figure out claim forms. So that's just some examples when it comes to the claims, but there are several other examples. But my point is that medical billing is not black and white. So you can't just learn medical billing in one day. That's why I always suggest that you at least take a class and learn the foundations, but the foundations are not going to make you an expert at billing. You're not going to know everything that one time. You have to continue to learn. As with me, I've been in this field for a long time, but every day, literally, it's something new and it's something else that I learn. The next thing that they don't tell you is that most doctors' offices, and I'm talking about specifically doctors' offices, this could be in hospitals and all that stuff as well, but I don't work or haven't worked in a hospital. But in most doctors' offices, the communication between staff can be poor. Again, this is not everybody, but I have noticed it in the offices that I've worked for, in the ones I've visited as a patient, in ones that I talk to. I know billers there, so I talk to them. Now, why is that important to us as billers? It is very important because if you know the revenue cycle, which you should as a biller, you will know that all of these people in the office contribute to you doing the billing. So right from the front desk all the way down to the provider, the nurses, clinicians, all of those people, coders, down to you, the biller, who is usually like the last person in the whole cycle. You all work together. So if the communication is poor, then it's going to affect the job that you have to do as a biller. If you're missing information, if the doctor doesn't speak with the clinicians and they don't know what each other is doing, that will really affect your billing. You probably will get a lot of rejections and a lot of denials, and you would have to rework claims that you've already worked before because of simple fixes that could have been done if the staff worked together and communicated better. I tell people that I am a detective, and I actually like to do a little bit of detective work here and there because there are times when I have to dig really deep and talk to different people, look in the records, decipher from what a person tells me from what's actually happening. And it's kind of like a little bit of detective work. And this is because, again, the communication is not good between staff members, and it makes your job as a biller a lot harder. So what they don't tell you is when you come in as a new medical biller, you have to be that person to bridge the gap between each section. Now, I say that because I work a lot for a lot of small offices. So you might be a biller and you don't have that relationship or that connection with the other different people in the facility or in the practice. But some way, whether you have to email them or talk to them or whatever, some way you have to bridge that gap so that it can make your job easier as a biller. So if you don't have the capability of maybe just going over to the front desk or speaking to them, you might have to go through your supervisor and let them know, well, this is going on. I'm noticing this pattern. This is happening. The nurse needs to do this. Like, you might need to step out of just your box of doing the billing and talk to the supervisor, like I said. But if you do have the capability of going to the actual person or, the front desk or whoever, I would recommend making that connection with them so when they have questions or when things need to be addressed, they will come to you and they will make sure they check to see if they're doing things right. So on the back end, you won't have to be fixing all the rejections and denials that could have been fixed beforehand. And then there's one that I think is very, very important, and this is especially for a provider's office, and that is to don't rely on the provider knowing everything. When I first started out, of course, I thought the doctor knew everything. So whatever they told me or whatever, I felt like they knew what was right and they knew how things were supposed to go. But remember, providers are not there to actually do the billing. Now, there are some providers, I have caught up with a lot of providers who have maybe been doing their billing for themselves, so they know how to do certain things, or they just want to learn, so they're involved in the billing. But a lot of providers don't know these things. They see it from the perspective of a provider. So when you tell them that they can't bill for this visit and this procedure in the same day, they will definitely give you a lecture about how, this is what they need to do, and, they don't understand why they can't, and bill it anyway and figure it out and all of that stuff, which I do get and understand where they're coming from, because they do it for the patient. They're trying to make sure that they give great patient care. When it comes to billing and insurance companies and stuff, insurances really don't want to pay out too much money. So they're going to make it kind of harder for a doctor to do all the things that they probably want to do, because now the insurance is going to need to pay for those services, and that's money out of their pocket. But a provider doesn't always know what to do, so don't rely on them. You take it upon yourself, the initiative, to learn the right way to do it, and to learn how to teach them the right way to do it. Try to explain to them what's needed, why it's needed, and show them resources where you got it from. Not just to tell them, oh, well, they say you can't build an office visit with a procedure, and not give them an explanation why that can't be done. On the other hand, they may want you to know everything. You may be hired as a biller, and then they want you to know credentialing, coding, the clinical side, without even realizing that that's what they're asking you to do. Even up until last week, I had a provider who did not really know the difference between coding and billing. So they were saying, oh, well, you do the billing, da-da-da-da. But then they said, on the other hand, you need to choose the right codes and blah. And it's like, no, okay, so the coding, if you want somebody to code for you, somebody to read your notes and code for you, that's a coder. If you want somebody to send out the claims and collect your money and all of that stuff, that's a biller. They still kind of didn't understand what was the difference. So you need to take it upon yourself to learn and to understand how to tell the provider about these different nuances. Don't rely on them to know what to do, because they went to school to take care of patients, or to learn how to take care of patients, not to necessarily bill. Although it would be beneficial to them, especially if they're not willing to hire a coder and they're just going to hire a biller, if they're the ones choosing the codes, then they should know why they're choosing the code, make sure that they're choosing the right code. But somehow, shape, or form, you still as a biller will have to kind of look over it, review it, ask questions, make sure that it's the right thing that's being billed, and not rely fully on the provider to choose the right codes. So these were just a few things that I think that was really important for you to know, especially as a new biller, because people tend to make it seem like billing is so easy and you don't even have to have an education about it, or you don't even have to know about it in order to get into it. And I just don't think that's right or that's fair. So be sure to check out these two videos right here, talking about what you need to know as a medical biller, part 1 and part 2. And I will see you again in my next video.